Good morning, everyone. Wait, that's not good. Good afternoon, everyone. Yes. So as you all see, we're joined by the one and only Reverend Al Sharpton and Rachel Noerdlinger, who, if you don't know, you should know. She is a strategist and a communicator extraordinaire. So we're going to be joined by Al B. Shore in a few minutes, but before we go there, I want to give the Reverend an opportunity to talk to you all about where we are, what just happened in Washington just yesterday, to give him that opportunity. And then we're going to talk about healthcare. We're going to talk about transplants. We're going to talk about the importance of breaking down barriers. But before we do that, I think it's important for us to put all of this into context. What happened yesterday, how it affects people of color, how it affects black people, how it affects our health. Rev?
Well, thank you. Let me say this. It is important that we understand that today, on the 4th of July, this president is signing a bill that will literally cost lives of our people and others in this country. It is going to close hospitals. It's going to cut Medicaid. It's going to take SNAP away. I grew up on welfare. They call it SNAP now. It used to be welfare. It's the same thing. And we as a people need not become depressed. We need to be determined that we're going to turn this around. That's why we need to vote, and we need to punish those that punish us. We fought people worse than Trump. We fought people that were harder than Trump, and all we have to do is put a new Congress in, and we can take this bill and turn it around next year. That's why I give a lot of credit to this team with the Black Economic Forum with Alphonso David, and I give a lot of, give him a hand. I give a lot of credit to Rich Lou Dennis, because they said we don't care what advertisers are afraid of DEI, they are not going to let us DIE. We are not going to die. We're going to fight back. And it is our mission. That's why we're here every year for 31 years. We've come here as a family to celebrate ourselves. If nobody celebrates us, we celebrate black excellence, the top artists, the top performers. We are still the baddest and the most beautiful in the planet, and we are not going to stop coming. They can't cut us out the budget. They cannot cut us out unless we cut them out from our budget. So you ain't got money for us, we won't have money for you. Because this is the reason it is essence, is we are essential to the American business community, and don't you forget it.
Now, Rev just outlined what this bill means for people of color, for black people. I want Rachel to also talk about the misinformation, because Rachel is a communicator, she's a strategist, and what you may read about this bill may not necessarily be true. It is important that we understand information and misinformation, and that's exactly what Rachel does. Rachel, I just want you to talk a little bit about what people should be looking for as they're dissecting their news so that they understand what's important and what's real.
Thank you, Alphonso, and of course, Reverend Sharpton. Honored to be here, and honored always to, of course, be working with Reverend Sharpton and Nan, with whom I've worked with for almost 26 years. So yes, we are in a dire moment where everything that we have in so many realms is at stake. And misinformation and disinformation are rampant. And some people don't even know what the difference is between misinformation and disinformation. Let's start with that. Misinformation is something that is misinforming, but not intentionally misinforming. It's a lot of what y'all do, we do on the internet every day. You see so much misinformation on the internet. Disinformation is intentionally done to mislead somebody. And disinformation has been the absolute staple of this current administration as it relates to everything that they do every day. in regards to this moment and this bill and how it's impacting us and how the disinformation can be pushed back upon, I think the first thing is people need to get involved locally. You have to understand what your local contingencies of elected officials, your local advocates, and people in the community that are actually on the ground, like the National Action Networks, that know what is real and what is not real. And a lot of this is also, folks have to stop believing everything that they see on Instagram, TikTok, and X, etc., because it's a very, very dangerous place to be. You have to really use discernment in this moment to ask the right questions and really, really come at this with an analytical eye and an activist eye. Everybody needs to hit the streets. As Reverend Sharpton said, it is time for us to continue to turn demonstration into legislation as we deal with misinformation and disinformation.
Now, that's about the bill that we've been talking about. I want to shift just for a moment to talk about healthcare. And the Reverend and Rachel and Albie Shore have been focused on this issue. When we think about healthcare for people of color and for black people, when you watch on the TV, when they talk about healthcare, they're usually talking about the challenges that we face, the obstacles that we face, the disparities that we confront. And here you have two people on stage, and Albie Shore is going to be joining us shortly, but you have two people on stage that have been working to remove some of those obstacles. And I want Rachel to spend a few minutes talking about what that is, and the Rev, of course, to talk about what that is, because it's important for all of us to understand that you may be healthy now, or you may think you're healthy now, until something happens. And then once it happens and you confront those obstacles, what do you do about it? Rachel?
So I actually am going to pass the mic to Rev because he is an embodiment of health and wellness in real form. If you look at him, you can see the transformation he has made in a very, very, very quick amount of time because of his serious commitment to want to live for his family, for his grandson, and for the movement that he built. He was in the gym at 4:45 this morning. So I think, Rev, if you would just speak a little bit too about your health and wellness path.
Well, let's look at the general population. In the most serious diseases in this country, heart conditions, cancer, diabetes, we are number one in all of the health defects. A lot of that is our environment. A lot of that is access to health care. And a lot of that is that we attribute our own lifestyles to something that is not healthy. You must remember, when we were enslaved, we had to eat what was given to us. We took what was the scraps and made it a cuisine. But that is not the diet that we need today. If you were working in the fields all day, sweating from sun up to sundown picking cotton, you could eat hard guts and you're going to sweat it out. But if you working behind a cubicle on a computer and eating hard guts, you're going to get obese and going to get diabetes and you're going to die. You're not slaves anymore. We must eat like free people. We must get checkups like free people. That's why the Affordable Care Act that Obama put through was so important, because it gave us access to checking on our health. First thing Trump tried to do was overthrow the Affordable Care Act. We put pressure on Congress, and they stopped him the first time. Now he comes back with this bill he's signing today that's going to close hospitals. People cannot go to hospitals if they're not there. So we need to use our muscle to deal with our health. Health is a human and civil rights issue. We should have the same access to health care as everybody else does. And one of the things that I did was change my diet and change working out. There was one time I was 307 pounds. I weighed this morning, I was 127. I did not I did not use, Ozempic or whatever that is. I changed my diet. I didn't take no pills. I stopped eating wrong. I started exercising because I am determined to live as long as I can and do as much as I can while I'm alive. So you must say, I'm a free man. I'm a free woman. I'm going to eat like that. I'm going to function like that. I'm going to check on myself. Why? Because you have enough self-esteem to say that I'm worth checking on. What kind of sense does it make for you to have a car and you check your fuel, but you don't check you? I know guys that got cars that check their cars more than they check their own health. There's something wrong when you care more about your oil change and don't check on your blood change and on your blood count. And if I go around most places that I speak and ask people what is their blood count, what is their weight, they don't know. But if I ask them how their car's doing, they can give me a description. We've got to get out of putting what is not important ahead of what is important. All of us are important. We're worth taking care of, and we're worth. And let me tell you, your bodily health, your physical health affects your mental health. Reason why you sluggish is because you're not taking care of yourself. You should wake up every morning ready to go, not wake up in the morning and somebody got to drag you out the bed and pray that you do something and you get to huffing and puffing. You should wake up every day as a new opportunity because you're fired up, you're engined up. Our health is our wealth, and that's what we need to protect.
Amen. Amen, amen. You know, as Rev was thinking, I was just thinking to myself that a lot of people confuse self-care with self-love. Self-care, we get our hair done, we get our nails done, we go to the barber shop, you know, we go to the spa, we get massages. But that is not self-love. Self-love are all the things that Reverend Sharpton just indicated in terms of taking care of your mind, your body, and your soul. And the mental health component is one of the most important things that we really, really are not as diligent about in this moment. Because of the state of affairs of this country, mental health we're hurting right now. And all of that manifests in our physical well-being as well. And so the greatest thing we could continue to do for each other and for ourselves is exercise self-love when it comes to your health and wellness.
Because it really doesn't matter if you got a good wardrobe on a bad body. It really doesn't matter if you got a nice hairdo on a bad head. It's like putting on perfume or cologne without washing. You just stink worse. We have got to start dealing from internal to the external and not just be externally looking fly and internally eroding every day.
So I want to ask this question of the audience. I'm not going to ask it about yourself. I'm going to ask you this question about anyone that you know or is in your family. How many people, or raise your hands, if your family members and your friends only go to the doctor when they're sick? This is what the Rev is talking about, right? How do we actually change the paradigm, and how do we reestablish our relationship with our health? We have a relationship with our bodies, and we have to make sure that we're nurturing that relationship, not when we're sick, but actually thinking about how do we nurture that relationship. And if we don't do that, we will continue to be the ones that are defining the disparities in this country. We're talking about colon cancer. We're talking about breast cancer. We're talking about fibroids. We're talking about all of the other conditions where black people are unfortunately at some of the highest levels. We have to reestablish our relationship with our health, and that's incredibly important. Rev, what do you say to someone who, if the person says, look, I work out twice a week, or I work out 3 times a week, isn't that enough?
No, you got to work out until you see the effects. That's why you need to be tested. That's why you need to have checkups. Some people need to work out every day. Some people can do it 3 times a week. It's according to where you start and measure yourself. Think of yourself as worthy, prime property. And if not, you are going to eat yourself to death. A lot of you know what I do. I preached James Brown's funeral. I preached Michael Jackson's funeral. I spoke at Aretha's funeral. I'd be glad to do your funeral. Keep eating like you eating. I'll pass my card around. You do not need to eat yourself to death. You do not need to not exercise. People talk about, well, exercise wears me out. That's the point. If you work out your fork more than you work out your body, you are killing yourself. And you and I are worth more than that. Don't let people again give you a slave diet.
So, folks, I want us now to transition and talk about this from a deeply personal perspective. Yesterday, we had the opportunity to extend an award. The Global Black Economic Forum held a health dinner, and we gave an award to Albie Shore and to Rachel Noerdlinger. And we are so pleased to have Albie Shore join us. Please. Oh.
I don't mind being the opening act for Albie Shore.
Never that. Reverend Dr. Al Sharpton, my big brother and mentor. So good to see you. My apologies for the delay. I was sitting in a parking lot waiting for a shuttle. But we are here and blessed.
So we're gonna flip the script just for a second, because this is the work that we have done around health equity in the last couple years has derived from urgency. Urgency in terms of what is happening around the country, and urgency in our own family. And about 3 years ago next month, Albie Shore was literally almost pronounced dead. He had multi-system organ failure, so many blood transfusions, he had a tracheostomy, he had every imaginable ailment inside of his body, so much that they were trying to send him to hospice. Reverend Sharpton and I spoke to his doctor. And by the grace of God, the Most High, when he awakens from a coma after more than 2 months, he committed his life to advocacy, to fulfilling the gap where there is a lack of equity and coverage for people that look like us. And so together we formed the Health Equity and Transplantation Coalition that Alphonso alluded to. We were honored last night. And so, Mr. Albie Shore, if you would just share with the people some about what it's been like almost 3 years after death.
It almost sounds like a Notorious B.I.G. album, right? Wow. Well, first of all, thank you, co-founder, BFF, the Queen, global strategist, Ms. Rachel Noerdlinger, thank you. I'm honored to be here at Essence this year. Forces almost didn't make that possible. But since we are here, I was so grateful to get a call one day from Rachel, and the prayers at the highest level from Reverend Dr. Sharpton, who kept up on my medical condition while I was down and made sure that folks were taking care of business. So I'm truly appreciative of Dr. Sharpton. Yes, please.
If you appreciate me, can I have a watch?
We have to get you your own for the birthday. We're gonna hook you up. That's a nice thank you. So July 12th of 2022, I was rushed to the ER. I just happened to be in Houston, visiting a friend by the name of DJ Eddie F. from Heavy D and the Boys. We grew up together in a place called Mount Vernon. And thank goodness I was actually in Houston due to the top medical care that Houston provides in the world. And this is where we're going with this. I entered the hospital at that point, and I knew that, let's say, July, August, September, October, November, I awakened from a coma. Didn't realize all that transpired. I knew what was going on prior to it, but by the grace of God, I woke up from the coma. I think the most important part about this is that the inspiration that Dr. Sharpton has always provided the nation and the world. Don't just sit there, do something about it. People have scrutinized my brother on many occasions, stating, why are you doing this? You're doing it for the spotlight. Why are you worried about young black men being killed by law enforcement? Why are you worried about these things? It's not your business. And they say, yeah, you're just looking for the spotlight. And Dr. Sharpton says, absolutely. I need to shed the brightest light on what's going on in the street as possible. So I've been inspired by my big brother to stand firm in the gap for equal access to quality health care. Rachel decided that we were going to get up and work right out of the hospital and removing multiple tubes from my tracheostomy. Rachel has this funny idea and says, hey, your brother has a new special coming out, a documentary on his life. Would you like to do some voiceovers? Mind you, and I'm not making light of this, but I know you've seen that commercial with the lady that can't speak because she has a hole in her throat from maybe smoking or something. Well, that's how I literally looked. There was a massive gap, so it took a while to heal. But for some reason, Rachel believed that I could actually go back and do voiceovers because I had been doing syndicated radio for many years. So part of this recovery and triumph is having people around you who believe in you at the highest level. Imagine Reverend Dr. Sharpton on the phone with a doctor when they're saying, we're going to send you to pasture. And I can imagine Reverend Sharpton saying, oh, I don't think my little brother's going to like that if he wakes up and you send him to die. So, again, within the medical crisis, we decided to step up in Dr. Sharpton fashion. We marched on Washington. We found out that Medicare was no longer covering the number one thing for me to survive and to continue to survive and thrive, which was the cost of blood testing for organ rejection. Organ rejection is something very unique. You can see me now and say, hey, Al, you don't look like what you've been through. Hey, keep it going, you look great. And then tomorrow, I may be gone. With organ rejection, it comes like that. So Medicare at one point was covering this blood testing to check for changes in enzymes and things of that nature. But they were no longer doing it. But this is also affecting the community. It's killing 50 to 75,000 of us per year. We can't take off of work. We can't get a biopsy. It's just way too much. It's just like Miss Johnson in the neighborhood. She's either got to pay her rent, buy her medicine, or die. And it sounds harsh, but it's the truth. I've learned to speak power to truth from Dr. Sharpton on many occasions when they challenged him. So I don't want to be much longer, but I just want to say thank you for the prayers. We will continue standing in the gap. We're thankful to the Global Black Economic Forum for the recognition. We're not going to get it solved ourselves, but while we are here, I damn sure are going to continue fighting for us in the community.
Amen, amen. I wanted to just point out that the work that we've been doing in this Health Equity Coalition has many, many senior advisors and people that have been working with us. And in the front row is one of the legendary entertainers and hip-hop artists from Philadelphia who himself had a kidney transplant and almost lost his life. So Freeway, we welcome you. We thank you for your continued advocacy.
Freeway in the building, y'all. Give him a hand.
So just starting to close out, I think that the moment, as Reverend Sharpton talked about earlier, that we are in with the cuts, with the closures, there were several hospitals that actually closed yesterday. And so when we leave NOLA, after we've been partying for 4 days with a purpose, what do we do? What are the next steps? How do we continue to fight the misinformation and the disinformation? So Rev, just one more time, if you could talk the political piece.
We need to organize locally, be involved in your local community, start in your house, talking about health care, talking about voting. It's not going to be something that's going to change itself. We must be the change we seek. The 4th of July celebrates the independence of the country. Don't forget, in 1776, we had already been slaves for over 150 years. We got here in 1619. They didn't get independent from King George until 1776. So we were brought here to serve and to slave and to not get paid. Now we're going to pay ourselves. We're going to take care of ourselves. We're going to stand up for ourselves. We are not going back. Many of you are getting the flyers that we're marching on Wall Street on August 28th. Why are you going to Wall Street, Rev Mal? The reason to go and rob banks. That's where the money is. We got to go and tell the people with the money, we will not go back. And there's no greater champion than that, than the Global Black Economic Forum. And that young brother, Alphonso David, give him a big hand.
Mr. Albie Shore, what next? Where do we go from here? Where do you continue to go to inspire others? What's next?
Wow. Well, we have a multitude of projects to take on moving forward with this new bill that was passed. As Reverend Sharpton being our leader in this space, I'm one of his prominent soldiers who will hit the ground and take direction and figure out what the next steps are as it relates to not necessarily having to fight the inevitable, but find a way to conquer it. We get tired fighting a lot. We have to do more thinking. Instead of playing checkers, we must play chess. Let the church say amen.
Amen.
So we're excited. We're excited about many things. I can mention, I guess, I have a new book that's forthcoming on Simon & Schuster. It's called Do You Believe Me Now? So when you get a chance, it's available everywhere.
It's already a bestseller on Amazon, and it hasn't come out yet.
So it's available for pre-sale. But I'm not here to talk about the book per se. This is such an important issue because if I didn't have the blessing of having a Reverend Sharpton and a Rachel who have significant influence around the globe, calling my medical professionals to guide them to, make the right decision and not just leave me on the table in the hallway. Not everybody has that privilege. So I want to make sure that every one of us in the community is allowed the same privilege of having equal access to quality health care at all times, no matter what your tax bracket may be, your area code. Let the church say amen. Come on. It's important to do so. We are all equal here. So we have to make sure that our government is recognizing that as well.
Alphonso, we thank you for the forum. I'm going to try to get a picture with Freeway.
Freeway, we would like for you to come up so we can take a picture.
Come on, give it up for Freeway.
Yeah.
Thank you all for joining us.